So we'll be talking about vascular bleeding disorders. We'll talk about the etiology, the pathophysiology, treatment. So bleeding due to abnormalities in the blood vessels are what are referred to as vascular bleeding disorders. Usually mild to moderate bleeding, resulting in petechia and purpura and at times ecchymosis. Platelet count is normal, platelet function may be normal, but due to the defects in the vessels, then there could be petechia or purpura. Coagulation is also normal. All your clotting factors are normal. So, and like we have discussed earlier on, there is a platelet vascular bleeding, which we didn't mention that, but we mentioned the platelet type bleeding, and we talked about coagulation bleeding, which could be deficiency of some coagulation factors. We know about the hemophilias that bleed into the joints, and we know about the platelets bleeding that will bleed into mucocutaneous region, and there could be mixed. We'll talk about how it could be mixed. So the normal hemostasis include the vascular phase. When you insert your needle to the vein to draw blood, the vessels will contract, anticipation of trying to minimize blood loss. Some hormones are released like endothelin will vasoconstrict the vessels. So after that, then you have the hemostatic plug, the primary hemostatic plug, and the secondary, which is the adhesion and aggregation. And then if that does not stop the bleeding, you have the uh, coagulation cascade being activated, then leading to fibrin formation. So those are the then, but apart from that, there could be defective vessels. The vascular integrity could be compromised. That can also cause compromise the mechanism. So usually when there is a structural defect in the vessel, so you can put on the phone, it's on your phone. So pathophysiology of vascular disorder could be structural defects in the vessel wall. You have shared it. Okay. Then it could be due to inflammation of the vessels. The vessel is rich in collagen and elastic fiber, giving it strength. Okay, and that's one of the mechanism in which hemostatic is. So when you want to draw a needle, and you put when you want to draw a blood and you put a needle, and then you are going to damage the collagen underneath the vessels, and the exposed collagen, will attract von Willebrand factor, and that's the addition. So the von Willebrand factor will attract platelet glycoprotein 1b, and there will be addition. After the addition, there will be aggregation. Platelet glycoprotein 2b3 will be exposed and then adhered to each other and will form a mesh. So that's the aggregation stage. So if you have a defective vascular wall, that can lead to bleeding. You have inflammation of the vessels that can compromise the structural integrity of the vessel. That can also lead to bleeding. The connective tissue disorders that defective collagen, defective elastin for one reason or the other can also lead to bleeding. The vascular fragility or rupture or any reason or the other can also cause vascular bleeding disorder. So it could be hereditary or acquired. So we'll talk about the hereditary causes of vascular bleeding disorders, and they are rare that you may not come across. They are rare diagnoses that you may not come across, and maybe except the von Willebrand disease, which is the commonest, and then you have the hereditary hemorrhagic telangiectasia. We're going to talk about that. Ehlers-Danlos syndrome. These are the hereditary causes. Pseudoxanthoma elasticum, and then osteogenesis imperfecta and Marfan syndrome. So we treat them one after the other. Those are the hereditary causes of vascular disorders. And then you also have acquired causes. We'll talk about acquired causes also briefly. So the I'll start with von Willebrand factor. Like I said, von Willebrand disease rather. Von Willebrand disease is associated with vascular bleeding due to deficiency or dysfunction of the von Willebrand factor. As you are aware, von Willebrand factor can be defective in quantity or quality. So, and then when it is defective, adhesion is compromised. Primary hemostatic plug is compromised. So, because von Willebrand factor must bind to the subendothelial layers with the collagen for you to ensure that you have hemostasis. So it could be reduced in quantity and it could be normal in quantity but defective quality. And that's what von Willebrand disease is all about. So if there is one von Willebrand disease, there will be prolonged bleeding time because of deficiency in the adhesion of hemostasis. So von Willebrand factor is a protein needed for coagulation and also for maintaining the integrity of the blood vessels wall. It's also found you have the one in the blood vessels and you have one under the blood vessels. So if it is defective, then there will be compromise. So this deficiency can lead to venous bleeding. Symptoms including bruising, prolonged bleeding after injury, and heavy menstruation. So it could result in platelet type bleeding and it could result in vascular bleeding. But it's essentially the same as petechiae, purpura. It is okay. But it could also cause coagulation type bleeding. And the reason is that von Willebrand factor is a carrier protein for factor 8. So when it is defective, it can lead to prolonged APTT. APTT is a test. About APTT that measures the intrinsic coagulation cascade, and factor 8 is part of the intrinsic. So if you have a defective von Willebrand factor, which is a carrier protein, either quantity or quality, then it will compromise the concentration of factor 8. Because that's why it can, factor 8 deficiency will cause coagulation, the coagulation factor. So it can present, so if you see a lady with a prolonged, because hemophilia is X-linked and is almost always seen in male. But if you see a lady with a prolonged APTT, prolonged normal PT, but prolonged TT, that's thrombin time. Most likely, if it is von Willebrand disease, not hemophilia, but it is possible to have a female who is hemophilic. How is it possible to have a female who is hemophilic? What, what condition will make a female be hemophilic? No, it's S-linked now. So one will be protective, and so in cases of Turner syndrome, what's the or is it X XO to XO, and the affected S is the one that is hemophilic. But apart from that, if we see prolonged APTT, it is most likely in female von Willebrand disease. So what do you do to confirm that? No, I said it's prolonged. So you are and a female. You do von Willebrand assay. You can assay it, find the quantity. So that's what you do. You can ask for von Willebrand assay, von Willebrand factor assay. So it should be lower. If it's lower, then okay, this is what is causing it. Because von Willebrand factor is a carrier protein of factor 8. And if you have deficiency of von Willebrand factor, that will be deficiency of factor 8. Okay, so that is how you can present with coagulation type bleeding apart from the platelet type bleeding. So von Willebrand factor is needed for platelet adhesion. We mentioned that an aggregation, the initial steps in forming, is also a carrier protein for factor 8. So deficiency of von Willebrand factor will cause a prolonged APTT. Von Willebrand factor plays a role in maintaining the structure and function of blood vessels. So nonetheless, easy bruising, prolonged bleeding after injury, heavy menstrual bleeding. So it can present as a platelet type bleeding and can also present as a coagulation. What is an example of a coagulation type bleeding? Usually bleeding into the joint, bleeding into the joints. Okay. So diagnosis involves blood tests to assess von factor and function. So you can do the assay and quantitate it, what level of von, as well as tests for other clotting factors. Okay, so this is the example of the various von Willebrand disease classification. So you have the type 1, type 2, and type 3. So type 1 and type 3 are quantitative defects, while type 2 is more of qualitative defects. Okay, so and they are almost always autosomal dominant. They are autosomal dominant and they are cause mild to moderate bleeding. Mild to moderate bleeding. So the type 2 also has various types. You have the 2A, 2B, and 2 that has poor quality. For river factor, when I say quality, I'm talking about the amino acid composition of the protein will be abnormal, but normal in number. It could be reduced in number. Just like you have thalassemia. You know, in thalassemia and sickle cell. In thalassemia, there's reduction in the amino acids of the alpha if it's alpha thalassemia, or beta if it's beta thalassemia. And in sickle cell, the number of amino acids in the beta chain is normal, except that you have the substitution of glutamic acid with valine. So that's the quality I'm talking. So similarly, von Willebrand factor can be due to abnormal quantity, reduction in quantity. That's type 1, type 1 and type 3. But it can also be due to quality issue, like you have in sickle cell or beta chain. And type 2 could be 2A, 2B. So that is the how von Willebrand disease can present with bleeding disorder. And I'm sure you are aware of the HESIS test. You know, I mentioned it earlier. We test the capillary fragility. You know, you inflate the cuff, the sphic to systolic and get the diastolic or value in between the systolic and diastolic. and leave the cough for like 5 minutes and watch out for petechiae. So it is expected that you have some petechiae. If petechiae may not be easily spotted in black skinned, unlike white skinned, but if it's you are counting 10 petechiae, it shows that the vessel walls are not as strong as expected. So they are fragile, and that's the persistence, and that's what you use. At times, it may be positive in thrombocytopenic patients. It can cause bleeding into the skin, thrombocytopenia. But if patient does not have thrombocytopenia and then there is positive persistence, then you can conclude that there is a vessel issue. Fragility is compromised, or the vessel is compromised. Okay, so the other ones, the other hereditary, the von Willebrand factor, von Willebrand is also hereditary as well, it's autosomal dominant. The other hereditary connective tissue disorder that can compromise the vessel wall. The hereditary hemorrhagic telangiectasia is also due to mutation of a gene called endoglin. This is HHT1 and HH22, and the gene is needed also for vascular integrity. So the condition presents with telangiectasia. What is telangiectasia? Telangiectasia is dilated vessels under the skin. You see a picture of telangiectasia. The vessels are dilated, and from there can lead to bleeding. So, of the mucous membrane of the nose, mouth, gastrointestinal tract, vagina, and skin. So the most common presentation of these conditions are recurrent epistaxis, and then if the vessels are dilated because of this mutation, then they are predisposed to bleeding. So, and usually mucocutaneous because they are vessels. So can present with epistaxis, GI bleeding, and even vaginal bleeding. So it can also present with actually recurrent bruising or skin purpura. Okay, so this is how telangiectasia looks. You can see that the vessels under the skin, they are dilated, and then they are defective, and you can ooze out blood from them, and then will cause all the symptoms that's like mucocutaneous that I've described, epistaxis, uh, uh, GI bleeding, hematochezia is what I was trying to, hematochezia, melena, and so on, then purpura, and then petechia, ecchymosis. Okay, so this is Ehlers-Danlos. Ehlers-Danlos is another inherited connective tissue disorder, but this one is due to affect connective tissue, primarily the skin. It's not only the vessels. Everywhere you have connective tissue, they are defective, and they cause hyperextensible skin, joints, hypermobility, fragile vessels, and spontaneous bleeding. So treatment helps manage symptoms and monitor for complications. So treatment options include drugs, physiotherapy, and sometimes surgery. So Ehlers-Danlos is another type of connective tissue disorder that can cause vascular bleeding. This is another hereditary connective tissue disorder, pseudoxanthoma elasticum. This has to do with deficiency of the elastic fiber under the vessels. You have the collagen, you have some elastic fibers under, so it compromises, the deficiency will compromise the vascular integrity. So a rare inherited genetic disorder causes mineralization and fragmentation of the elastic fibers. So it does not only affect the vessels alone, but the skin, the eyes, and blood vessels are also. So elastic fibers, just like you have the collagen under the vessels, you also have elastic fibers under this. So this is what is known as pseudoxanthoma elasticum. So there is no confirmed treatment that directly interferes with the disease process. So most of the time we do a skin biopsy that can give you idea of what the diagnosis is. So there's osteogenesis imperfecta is another hereditary condition that can cause so known as the brittle bone disease. It's a genetic disorder characterized by bones that break easily. It's caused by defects in the collagen protein, which is crucial for bone structure. So it has to do with collagen too. So any issue with collagen, with elastic fiber, if they are compromised, they are going to compromise the blood vessels and will cause bleeding. So it's just giving it another name, but almost the same pathogenesis. Treatment includes bone strengthening medication, physiotherapy, and orthopedic surgery. Okay, so the other one is the Marfan syndrome. It's also related to collagen. Okay, genetic disorder, but collagen is also found in other areas of the body like the skin and the joints. So if there is a defect in collagen, so it may not only affect the blood vessels, it can affect the skin, it can affect the joints. So genetic disorder affects connective tissue which support many structures in body. So it primarily impacts on the heart, blood vessels, bones, joint and eyes. People with Marfan syndrome are tall and thin with long arms, legs, fingers and toes. So treatment include medication to keep blood vessel low, blood pressure low, glasses and contact lenses and surgery. Because it affects the eyes. Most of these conditions there is no permanent cure. So just those are the hereditary causes of vascular. We have the Ehlers-Danlos, we have von Willebrand disease, we have Pseudoxanthicum elasticum, Ehlers-Danlos syndrome, and the Marfan syndrome. So, but the acquired senility as you age, sarcopenia, you lose muscles, you lose so. You can also lose the underlying structure of the vessels and can cause purpura. Okay, senile purpura caused by atrophy of the subcutaneous. As you age, you lose muscles, and not in all cases anyway, but most old people they become skinny as they age. So there is a progressive loss of collagen and elastin fiber. So as you lose collagen, you lose elastin. So these are acquired causes, not inherited with aging, which leads to inadequate support of the subcutaneous blood vessels and can, if you have defective support. So, but steroid can also thin out if you use a lot of steroid, prednisolone, dexamethasone. It can thin out the collagen. Infections can also affect the collagen and the elastic fibers. And then even allergy, there is vasculitis allergic vasculitis can damage the collagen. The antibodies can damage the collagen fibers. So those are the acquired causes of. So you also have a metabolic vitamin C is also needed for collagen synthesis. So scurvy, which is deficiency of vitamin C, can cause, but it's very rare to find, except in sailors who are on sea for months and they won't take any fruit, any fresh fruit that contains vitamin C in those days. But I think they have been able to get around that. Severe scurvy or vitamin C deficiency typically presents with bleeding from multiple sites because the collagen that is needed for structure of the vessels is compromised. Vitamin C is needed for, and that's why we use vitamin C for wound healing. You need, it's going to aid collagen formation, and if you have collagen formation, the wound is going to heal on time. So if you have any wound, vitamin C is part of the medication that should be used. So if there is a deficiency, it can cause bleeding, purpura, skin bleeding time may be prolonged, but platelet function test, because vitamin C has nothing to do with platelets. So it's just the collagen that gives structure to the support to the vessels that is affected. So, but amyloidosis is another that can infiltrate the vessel wall. It's a disease that can infiltrate the vessel walls and then damage the collagen content, the elastic fiber content. You are going to come across amyloidosis in pathology, and then that will be, but it's an infiltrative disease, and can infiltrate the liver, can infiltrate the lungs, everywhere, including the vessels. So if it infiltrates the vessels, then it's going to cause damage to the collagen, and then cause bleeding, vascular bleeding. So, like I said, administration of steroid can damage collagen structure and cause uh, LSHODS surface. So, steroid can damage the collagen, like you have in Cushing syndrome, where there's excessive steroid production in Cushing syndromes and can cause bleeding disorders. So, like I said, allergic vasculitis, allergy, antigen antibody can damage anything that has to do and cause infiltration and inflammation of the blood vessels. And chemicals, toxins, and infections can also cause a damage to the blood vessels, okay, and cause bleeding. So, but the allergic type, the enoxaconlin purpura, which may involve the skin, is an allergic vasculitis. So, but the cause may involve the skin, joints, gastrointestinal tract, kidneys, heart, and CNS. Is a well-known cause of allergic vasculitis. Then drugs like aspirin, sulfonamides, beta-lactams are all implicated in vascular type of bleeding. I think that will be the end. Okay, we have the clinical features: easy bruising, little excoriation will cause bleeding, petechiae, purpura, recurrent nosebleed, mucosal bleeding, but no joint or deep tissue bleed except in one condition: von Willebrand. You have a von Willebrand disease, that could be mixed mucosal and joint bleed, because von Willebrand factor is a carrier protein to factor 8. So you take history and physical examination, a full blood count, at least to be sure that platelet count is normal. But if the platelet count is normal and you do the Hes's test and the number of petechia seen on the forearm is, then you can execute. Then if history of steroid use, those drugs, allergy, you can then start concluding that could it be vascular bleeding disorders. Okay. Then do a skin biopsy. If you do a skin biopsy, dermatologist will do a skin biopsy, send for histology, and they will see that there is a defective collagen under the skin, or defective elastic fiber under the skin. So that will be suggesting um the cause of bleeding. So you have to exclude platelet and coagulation disorder. You have to do a PT and do a PTT, despite the fact that there is no joint bleed, to be sure that this is not a coagulation vascular, just a partially coagulation disorder. So the treatment, so most of the time, the hereditary is supportive care. There is no cure. You just support the patient and avoid excoriation. Corticosteroids in vasculitis. Corticosteroids can cause vascular bleeding disorder, and when if it is due to inflammation, you can also use corticosteroid to reduce the inflammation. So it can be used for both genetic counseling for those that have the. So vascular bleeding disorder is uncommon but important. Diagnosis is usually clinical and exclusion. Management is supportive and you treat underlying disease. So thank you for listening.